That was fantastic, and it's wonderful to have all that knowledge exposed to a multidisciplinary audience. So we've got a little time for questions. We have a question in the front.
Good afternoon, dear Professor. Thank you for your presentation. I have one question about the recovery of menstrual cycle of your patients. How many patients did return their menstrual periods after the 3 months of your treatment of acetyl L-carnitine? Thank you.
That's important. This is a very clinical relevant question, since we really need to understand that the recovery of the menstrual cycle is a sort of gift that Mother Nature gives to the patient if she is following a changes of the diet and probably in, good adjuvant treatment as the one that we made. Less than 30% of the patients after 3 months of treatment recovered the menstruations, which might be considered a failure. Well, we want them to menstruate. But look, there are a lot of women today here, and you know very well that women are not all the same. Because if women would be all the same, you treat one, you treat all. That's wonderful. But it's not what is the reality. So each of these women will be able to cope with the same stressors, with the same way of eating in the bad, the wrong way, in the same way of training, agonistic purposes, or just the gym, in a completely different way. So the biology of each woman is more or less similar to the, Matryoshka? The dolls? You might know this. Well, each woman, let's say Carla, is a Matryoshka with another Carla inside. A smaller one, but tougher. The one inside is the one taking and driving the rules for the biology. So it's relevant that the Carla outside is able to teach or to chat and to be kind with the other one inside, just not to displease her with wrong feeding, wrong training, and wrong of stressors. So whenever the one inside is not able to say, okay, let's start, you'll never get the results of menstruation. But the relevant signal, the positive one, is the improvement of LH. You have LH if GnRH is released, and this means that the hypothalamus is working, and all the machine from the top of the mountain starts again to work.
Thank you, Alexandra. We have time for one quick question from the front here.
Aksa from Iran. Thank you for your presentation. When you start L-carnitine for hypothalamic amenorrhea and the patient gets pregnant, do you stop the L-carnitine or continue during the pregnancy?
No. Well, usually being this an integrative compound, we are usually asking the patients to stop carnitine. But since when the patient is really motivated to get pregnancy, she wants to be safe in having the pregnant moment, we try to taught her just to have the best nutrition, if possible. So we are trying to avoid to go on with carnitine during pregnancy, but we want them to have a diary of the feeding. And we want usually at least 150 grams of meat, red meat, every day. And if you have this, you have everything, since inside the meat you have carnitine, you have the B12, you have vitamin C, you have vitamin D, and you have everything which is just enough. 20,000 years ago, pregnant women were eating not cooked meat, and the humankind is here. So I think that meat is the real solution. When you do not eat meat, carnitine is relevant, but patients need to learn what to eat and how to cope with external environment.